What I am looking for, basically, the long and short of it, is someone who is safe, who is motivated, and has a growth mindset. And how you think you will add value to that department. The moment I see a CV like that, I can guarantee you I'll invite them for an interview.
I got it.
Okay. So, and also some self-awareness is important. Rather than saying I can do everything under the sun, then I would say please apply for a consultant position. What we hire for increasingly is attitude. Attitude is something that can't be taught. Knowledge can be upgraded, skills can be upgraded by repetitive doing of the same thing. And let's face it, any branch, and especially anesthesia, every consultant appointment is like a £2 million investment. Because once you take them, you can't get rid of them. They can exist, okay? And even 100,000 a year for 20 years is 2 million. Personalize your answer to why you want to work at our hospital. Okay. Then you get a call from the accident and emergency saying, I've got a head injury who needs intubation immediately. Okay. Please come down. And you are the only 2 people in the hospital.
In the OT cases.
Your case is going on in the OT. You're doing a craniotomy also. Yeah. And this is the first year postgraduate who just joined about a month ago. How would you handle the situation?
Hello, this is Dr. Dheeraj Masapu. Today we have Dr. Shishir Chandrasekhar, who is head of the department in a big corporate hospital in Bangalore. Welcome to the channel, sir.
Thank you, Dheeraj. Nice to be back again.
Thank you, sir. It's my pleasure. And today I would like to ask you a very tricky question. So we would be conducting interviews for people who are joining in your department, anesthetists. Yeah. So I will give you 2 different scenarios. Yeah. So I want you to tell us how would you conduct the interview and what are you expecting from the candidate, basically.
Sure.
So one of the first scenario is a person who finished his MD or DNB and without any experience is trying to join your department as a senior resident. Okay. And the second scenario is a person with 8 to 10 years experience and he has significant degrees and research articles and foreign experience. He is coming for an interview for a consultant position. Okay. So in both the situations, how do you interview them and what do you expect the answers to?
Sure. Interesting. It's not a question I've been asked before, so I'll have to think a bit on my feet now. It's a very, very important question to ask, and it's something, especially for any postgraduates who are, plenty of them, I think, are Dheeraj subscribers and will be watching this. This is a great head start that you're going to get, which no teacher will typically teach in a course. So first things first, the way I look at it, I can speak from my own personal experience of having recruited probably north of 30 or 40 SRs over the last 8 years, probably even more. So I think what happens is, first, I think it's important to understand the demand supply side of things. A lot of SRs are not aware when they're applying. First, we'll take the SR questions and then we'll look at the consultant, because they're 2 slightly different things I'm trying to assess. So in an SR, the reality of Bangalore, especially East Bangalore where we practice, is that there is quite a huge oversupply of anesthetists wanting to work in this area. Now, nationally, there may be a shortage of anesthetists. State-wise, there may be a shortage of anesthetists, but certainly there is no shortage of anesthetists wanting to work in a good corporate hospital in Bangalore. So that is the first thing to understand, that when you're going up for a job like that, you're competing against many good candidates. That said, you have to understand what it is that a head of the department or someone running a department is looking for. What I am looking for, basically, the long and short of it, is someone who is safe, who is motivated, and has a growth mindset. Each of that I'll come to in a little bit. So the way the interviews typically go is that what we are trying to do is we, of course, get a CV either through personal contacts or through the HR. And then what we are trying to do when we meet the candidate is to size up to see if the candidate is what they are as they appear on their CV. So first things first, even before an interview, make sure your CV is up to the mark. Get some advice how to get a good CV done, which is probably topic for another talk if you want.
A little bit, can you tell what do you consider as a good CV, just briefly?
Sure. A CV should not only tell me your basic details and personal details and where you have trained, but it should also serve as a statement of purpose as to why you want to join a particular organization. When they're wanting to join me or my department, I want that personalization of the CV. Okay. And one good structure I would recommend to people, other than obviously with their personal details, you don't have to write your date of birth, your marital status and all that. It doesn't matter. These are professional CVs. Okay. So some basic personal details are fine. Beyond that, where you have studied and where you have worked in reverse chronology. So then first, the job you're currently doing should come first and the older jobs later. So what we call reverse chronology. So other than that, what we are really looking for is something called the CAMP structure. Is what is one good way of doing a CV. So CAMP is an acronym for clinical, academic, management, and personalizing the answer. Okay. So this is a great way. So when I look at a CV, I should be able to by looking at that CV, able to tell what is the clinical competence of this particular individual. Okay. What are they capable of independently doing? What have they done under direct supervision? What have they done under distant supervision? Okay. So that gives me a good idea of the clinical qualities of this person. Next thing I want, we are a DNB institution, we are a forward-thinking organization. I want people, even at an SR level, who can add value to the department. And how does value addition happen? it's through academics. So those who are, suppose they're interested in academics, a list of the presentations that they have done in their department, or the proudest presentation that they can think of that has changed the way they think about anesthesia. Something along those lines, if they can personalize, that's fantastic. Now, many SRs as final year postgraduates have probably run rotas. They've probably helped organize a conference. So all that comes under management skills, and often they don't realize. So if you put that as a management competency that you have developed at that stage of training, that sets you apart from the average postgraduate.
Got it.
Finally, you should personalize your CV to say I'm applying to X hospital. Try to write a bit about that hospital, that you understand what job it is that you're going for, what the expectations are, and how you think you will add value to that department. The moment I see a CV like that, I can guarantee you I'll invite them for an interview.
Okay, got it.
Okay. So now we'll go to the next stage where we have seen the CV, interviewed, and have called the person to interview. So we understand it's a very nervous time for the person coming in. Our system is fantastic at picking up academic rigor, making them pass exams, vivas to a point. It's all very very content heavy vivas that they would have done either as postgraduates or as undergraduates. But the interview is not designed to test how much anesthesia you know. That your degrees, your CV, your references, the pedigree of the institute you have worked in will tell us by and large. What we want to understand is the person behind the CV.
Okay.
So typically an interview would go something like, to break the ice, I would ask something like, please tell me a bit about yourself. Okay. And often you'll be surprised how unprepared these young postgraduates are to even answer such a question. They're like, I am so-and-so, I was born in this place, this is my date of birth, I did my MD. Yes, all of that I know in my CV by looking at your CV. I want you to know, what I want to do firstly is to put you at ease, and then to get some extra information about yourself to me. Again, here the CAP structure works very well.
Okay.
So if you just talk about it, rather than just talking 3-4 minutes about everything that is already there on your CV, you could personalize that answer by saying that, I am so-and-so, trained at this medical college in my undergraduation, I've done my postgraduation here, and my chief clinical strengths are 1, 2, 3. My chief academic strengths are 1, 2, 3. Just imagine how much different that answer will stand out from the crowd.
Yes.
Okay. And then what you can say is, I want to work in your hospital because of reasons 1, 2, 3.
Got it.
And I want to grow. I want to be a better anesthetist this time next year than I am now. Okay. And that is again a very, very important thing that we look at. So largely speaking, education and how we assess skills are how we assess somebody is based on 3 parameters: knowledge, skills, and attitudes. Knowledge, your CV will tell us. The fact that you've done an MD or a DNB from a good institute will tell me that you have a reasonable knowledge base. The fact that you've passed a competitive exam to get in and get out. Yeah. So both of that tells me that. Your skills, chiefly your references will tell us what they can do. And also some self-awareness is important. Rather than saying I can do everything under the sun, then I would say please apply for a consultant position. So you have to tell me that you're good at the basics, but you want to learn and refine yourself more. Okay? So, but what we hire for increasingly is attitude. Attitude is something that can't be taught. Knowledge can be upgraded. Skills can be upgraded by repetitive doing of the same thing. And let's face it, any branch, and especially anesthesia, has a steep learning curve. Within about 5 years, the skill sets of most people will be more or less similar. Where a consultant and a senior consultant will stand out from a 5-year experience anesthetist is in judgment, is in communication, is in resource management, is in situational awareness. All of these are attitude-based things. And these are very difficult to teach later. Yeah. So what we hire for is someone with a growth mindset, someone who realizes, who's justifiably proud about what he or she has done up to that point, but has an even more keenness to improve.
Got it.
That's what I look for. And that's what most heads of departments are looking for. Someone who is trainable, who has the good raw material that we need, and who is capable and willing to be worked upon to get to the next level.
Got it. So if they come till this stage, then they're selected.
Very, very likely they will get selected. Sometimes it's also a demand-supply situation. And some head of the department like me will not keep an oversupply of people. Okay, we all have to balance the finances. We have to balance the needs of the department. But many times it's happened that I've interviewed a very good potential SR. There was no opening, but I've kept their details. And the moment an opening comes up, we have reached out to them first. So that also, and even if we don't reach out to them, we may refer them to somebody who we know and say that, look, I've done your work for you. Now you're working in a different hospital to mine now. Now I might see somebody good. If there's no opening, I will immediately call you and say, Dheeraj, I think we have a good candidate here. Would you be interested? And this is how it works. And after a point, who you know will matter as much as what you know.
Contacts.
Yes. networking in a good sense, in a good positive sense.
Got it.
Yeah.
And now the second scenario, let us discuss. A consultant has come with foreign qualifications and a very good CV, decent publications, and some audits he has done.
Yeah.
So you felt that he's a very good candidate. Then how will you go with the interview?
Okay. So with consultants, especially in a private hospital scenario or a corporate hospital scenario, what we are looking for is a bit different at times. Firstly, it's where people have to understand whether we like it or not. There is a pyramid system. There are going to be probably 3 to 4 as many as the ratio might be something like 1:3. For every one consultant, a typical hospital may have 3 SRs. So naturally, you are going to again have to compete amongst the SRs. If you want to grow up further and go up the chain further, as it were, it gets more and more competitive. So the consultant openings are not going to be as many as those of a registrar's opening. So consequently, as someone who is hiring consultants, we need to think mainly about what value add that person is bringing.
Okay, good.
Okay, and that value add can vary slightly. Firstly, it's like a cricket team, for example.
Yeah.
A cricket team is not going to have 11 Virat Kohlis or even 11 Rohit Sharmas.
Yeah.
So you may actually find extraordinarily good consultants applying for a position, but a position may not be available because, say, for example, just as an interest, you were in neuro with us for a long time. Say another extraordinary CV comes with neuro. Unless there is an opening, I cannot take it. Yeah. Although I know that person would have been excellent. So this is something from a supply-demand point of view that people have to think about. In fact, the easiest position at the moment to be in is a generalist with a special interest in something.
Yes.
Every hospital needs that. Every hospital may not need 2 or 3 DMs in cardiac or pediatric or neuroanesthesia, but every hospital requires a good, solid generalist with a special interest. So that is something that you need to think about your CV. As you're building your CV up, you need to think about where it is you want to work.
Right.
And based on that, may not be the exact hospital, but what type of hospital you want to work in, and tailor your CV accordingly.
Got it.
Okay.
So basically, in a hospital like yours, how many consultants can be there? Like, because that will relate to other hospitals.
Correct. So we typically cover something like 16 to 18 areas of work every day. So the way we hire is based on how many areas you have to cover, not just the number of cases.
Correct.
Okay, that's how the demand supply works. So to cover 18 areas, I need essentially 18 people who can work on their own. Not all 18 need to be consultants.
Got it.
So probably something like half that workforce of the 18 needs to be of consultant level.
Got it.
Because when patients come to corporate hospitals or any private hospital, you are paying or they are paying to be treated by a consultant.
True.
Or a qualified anesthetist at the very least.
Yes.
So that is how I look. In our department, we have something like between senior consultants and consultants, somewhere between 10 and 12 people in a 30% department.
So, correct. But if you take it as 10, for example, your kind of hospitals will be maybe 20 in a metro city.
Yes.
So in a city, maximum 150 consultants can be there.
In this sense, who are consultants in a corporate hospital doing, on a retail. So there are many ways of working, but yes, that I think that would be a reasonable ballpark.
There are a lot of freelancers, there are a lot of other kind of medical college jobs and all there. But in this corporate kind of a consultant, so that's very less number actually, because per year, 7,000 anesthetists are passing out.
Yes.
That's
true. So this is what I mean, that global numbers don't mean anything. The doctor-patient relationship ratios that they give pan-India doesn't mean anything. I mean, according to that, we are still several tens of thousands of doctors short. But that is certainly not true when you look at micro environments like say Bangalore or Mumbai or Hyderabad or Chennai. There is definitely an oversupply of doctors because rightly or wrongly, we all want to live in cities. We want to live in a comfortable environment. We feel we have earned the right to choose where we want to live. And that is something that, that is free will that cannot be tampered with. It should not be tampered.
I'm from Rajahmundry in Andhra Pradesh. I'm in Bangalore now.
Yes.
Like me, so many are there.
Yes. And that's absolutely okay. And that's absolutely right. So what it then means, though, is that you have to start planning for those openings quite early on.
Yeah.
So when I look at CVs for consultants, every CV can look much the same.
Yeah.
Unless you have done something that makes you and you've developed a personal brand of your own.
Correct.
It's very, very important because you are the product. Whether we like it or not, the person who's applying is the product asking to be picked up by a certain hospital.
Right.
So the way you're going to make your CV stand out as a consultant is during the years of SRship. Typically, we wait at least 6 years post-MD or DNB to be taken in my hospital as an associate consultant, something like 9 or 10 years before they become a consultant. And that is actually a very sensible way of looking at it because a consultant is not merely a competent anesthetist, but a good anesthesiologist plus extras. And the plus extras, what are they? it could be different for different people.
Okay.
Again, I would encourage you guys who are SRs listening to this to start thinking about how you want to develop your CV. Look at the clinical aspects. Are you learning? Are you improving? Is your clinical skill set now better than it was this time last year? How are you going to make it even better next year? Academics, have you shown any interest? Have you attended conferences? Have you presented any papers? All of these help you stand out from the crowd, because everybody, trust me, who applies to a hospital like us says, I am very hardworking, sir. I am very popular. I am a team player. It may all be true or it may not, but there is no way for me to find that out. And nobody's going to come to an interview and say, I won't work hard. I have problems with my attitude. Everyone is going to put forward their best version of themselves. So what we then need is more objective proof, especially at a more senior level. So academics, again, like the camp that I keep coming to, clinical, academic, management, then personalize. So academics, start talking about what you have done and how you're going to improve. So it could be doing an additional diploma, for example, in teaching, or doing web-based teaching, thinking of newer ways of connecting with students. Every hospital would, like us, which runs a DNB program, we welcome people with teaching experience, because frankly, not many consultants may be interested in teaching. And someone who can take that and do it with passion can make all the difference. And in our hospital, we've been lucky. All the people who have led our academic programs till now have been passionate teachers. And that's made a whole lot of difference.
Totally chose also like that.
Exactly. And we chose based on that. Yeah. Someone else's strength may be management. They may then they may want to do a hospital administration MBA.
Yeah.
And these kind of guys will be even more attractive to management than to the HODs.
Good.
Because they are thinking, they are in growth mode. They want people who are an asset for them for years, perhaps decades. When you're hiring, you have no idea how long they're going to stay with you. But you have to be prepared that they stay with you for 20 years. In the UK, they would say, every consultant appointment is like a £2 million investment. Because once you take them, you can't get rid of them. In the NHS, okay? And even 100,000 a year for 20 years is 2 million. That's what you're spending, and probably they cost a lot more than that. So that's what my ex-boss used to tell me, that when I hire, if I don't find the right person, I'd rather not hire anybody than spend 2 million of taxpayers' money on hiring the wrong person. Okay? So same way, we also look at longevity, potentially what will they add to us? So those with management interests, it's not enough to say I'm interested. For example, if you were an SR, you were running the rota, something as simple as that will help you stand out from other SRs who didn't run the rota. Yeah. Then do a course. There's so many courses available online. Some courses, there are so many such courses. I think you know better than me what sort of courses are available. Anything like that will help you. And then finally, personalize your answer to why you want to work at our hospital. Okay. Do some basic research. It's not that difficult to find out how many people work here, what sorts of cases happen. And if you come to an interview and tell me that, I know that your hospital does majorly, say, neuro or ortho or peds or whatever, and these are my strengths and this is how I see myself fitting. Okay. Immediately you win brownie points because you bothered to research about our hospital. It shows a genuine interest.
Okay, my strength is matching your hospital. I want to grow here.
Exactly.
In that way, they have to.
Exactly. Rather than just telling I'm very good. Yes, you are very good. That's why we are calling you for the interview.
So the similar kind of interview will happen even if they apply for UK university and everywhere.
Absolutely. Absolutely. And that is what they're looking for. They're looking for all-rounders. See, a consultant, like I keep saying, is a lot more than just a mere competent anesthesia provider. That is a given. Okay. After 7 years, 10 years of doing the same thing, we will expect you to be competent. One person may be marginally better or worse than the other, but neither of that is going to give them a huge edge. What will give them a huge edge is mainly the additional stuff that they have done and their attitude and a growth mindset.
So now I'll ask a tricky question, sir. What we should not talk or tell in the interview? Like how careful we should be? Like, can we expose our weakness in the interview, or what we should not talk about?
So that's a question I often ask people in the interview. What are your weaknesses?
Okay.
And if you tell me you have no weaknesses, it's either you're being defensive or you totally have no insight. It's neither of which is true. So we all have weaknesses. We understand that. So that is actually a way of asking, what have you really looked at yourself? Have you reflected upon yourself and about your practice?
Got it.
So in fact, if you asked me what my weakness was, I would definitely have to think, and I would say something like, for example, I find it difficult to say no to people. Something like that, which is neutral, which nobody can disagree with. And then say that, what it has meant is that, I kept saying yes to everything that came my way, but it started affecting my personal life. Yeah. And then I realized that I'm not just a professional, but also somebody's husband, somebody's father. And then I realized that I had to balance the two. I have still not reached that steady state, but I'm working on it. Something like that exposes your human side without giving too much away. So yes, you should be prepared to talk about a weakness, provided you have had the insight to understand what it was and are doing something about it.
So if you have enough strengths, then you talk about weakness.
Yes.
If everything is a weakness, then better not to talk about.
And it's a great way to assess ourselves honestly. And I tell that to my team also every year, that every year sit down with yourself or with someone whom you actually are a bit scared of in the department. Not the nice persons alone. Someone who will be honest and tell you for what it is. Sit down with your CV and make them ask you, how have you improved this year? Do what is called a SWOT analysis. Strength, weakness, opportunities, and threats, So, and that's what is called a talent audit. A lot of corporates do that, not in healthcare, but in other fields, they do that.
They come in corporate.
Absolutely. It's just a matter of time. And what typically happens with all of us, including me, is that our strengths continue to be our strengths. Our weaknesses continue to be our weaknesses. So 5 years later, if I am the same guy I am today, that is not really growth. That's just 5 years of doing the same thing. That's not 5 years experience in my book.
Got it. So basically what I understood is the interviews and everything in the SRM only will happen. After that, it's a natural progression in that particular hospital.
Yes.
So parallel entries are difficult. That is very rare.
It is, vertical growth is important, but vertical growth is more difficult. Okay, it is not as easy as people think. It's not just staying in the job for X number of years will automatically guarantee you a consultant position. It may, but it may not. Because unless people feel you're adding value, because obviously the salaries are different between a consultant and a registrar, the responsibilities are different between a consultant and a registrar, and management have more of a say in consultant appointments because they are thinking big picture.
Yeah.
If suppose they are in expansion mode, they want some consultants on this hospital to be able to go and run another department.
Correct.
So all those things come in. Just mere competence will not be enough. They are looking at the overall value proposition that an individual gives them.
Got it. There is another kind of a person who doesn't do anything but is loyal to you for years and years and years. How do you manage such kind of people? Whether they can grow? Because loyalty...
Yes, loyalty is important.
Yeah.
So first thing I would probably do is to understand why they are not growing.
Okay.
Have they got other issues at home? There's many of us can't give it 100% all the time. We all go through peaks and troughs in our careers. So if it is something that it is recoverable, I would encourage them. And that's how we have actually tried to do in our hospital as well. Sit with them, try to understand them. You don't have to be their personal friend, but more from a professional point of view. What can I do to help you grow? And what do you want to grow to? So most of us don't know what we want to be.
Yeah.
If you have an end inside that, I want to look like this in 5 years' time, then it's easy to work towards that, or easier to work towards. If I don't even know what I want to be in 5 years' time, I'll just carry on doing what I am. So that often happens. Usually the ones who can appear less motivated, there'll usually be a reason. It could be a health reason, either physical or emotional health. It could be family reasons. Or some people are just contented people.
No, more than contented, what I observed is if they start doing more, every time you can give more work to them.
Yes.
That mindset also is...
That is true. It is true. And to an extent, it's true. Because what you would do is encourage people who are proactive.
Yeah.
And naturally, the rate of growth is going to be different. See, if you are like that, then you have to also accept the side effects that come with that, isn't it? Your rate of growth is not going to be the same as someone who is willing and showing more initiative. Yes. So that has to count for something.
Yeah.
And that is how all hospitals are. And it's not, and many people are under the misapprehension that only one person will decide the growth of a person. It's not just the head of the department. Lots of inputs go to management from the surgeons we work with, from fellow consultant colleagues, and from the nursing staff. A lot of feedback. And usually in my experience, when I have seen growth being slow, it is seldom due to clinical reasons. It's mainly due to attitudinal reasons.
Okay.
And nobody is going to will be willing to promote somebody who has attitude issues or anger issues, even if they're competent. Because they know that the moment you give more and more seniority to a person like that, it can become more of a problem or a hindrance to the organization.
Got it. So then, so these are so we discussed different ways to actually grow in the organization and different questions that a senior resident would get when they come for interview. And these questions, as well as telling, the same questions will be asked if you go for interview in the UK or even Dubai and Abu Dhabi also they conduct interviews, and even Oman, Muscat, Kuwait also they conduct interviews. I think it will be similar.
Very similar. And especially in the UK, I can speak for because I attended multiple interviews at various stages of my training. The more senior you get, the fewer clinical questions you get in an interview.
Okay.
The assumption is that you are a safe clinician. Otherwise, you would not have lasted that long in any hospital.
Right.
And that's true of India also. So what we will be looking at when we are interviewing a consultant is put them in a difficult, either an ethical dilemma or some sort of situation where they have to take one side or the other, or things like, resource allocation. So an example, a typical question that I would ask, and I'll have to stop asking after this interview because people will hear that, is suppose you're working with, you're a senior registrar, you're working with a first year postgraduate, you've got a craniotomy on the table.
I'll answer that question. So.
Okay. Yeah. We have not discussed this before. So you are the neuro anesthetist. You've just joined 2 years ago to Sakra, to our hospital.
Yeah.
And you got a fresh postgraduate working with you.
Yeah.
And then you get a call from the accident and emergency saying, I've got a head injury who needs intubation immediately.
Okay.
Please come down. And you are the only 2 people in the hospital.
In the OT cases,
your case is going on in the OT. You're doing a craniotomy also.
Yeah.
And this is the first year postgraduate who just joined about a month ago. How would you handle the situation?
First would take a call based on the situation's requirements. So the requirement which is there down is intubation,
Yes.
which a first year candidate might not do even if he goes there.
Yes.
The requirement inside the OT is maintaining the case.
Yes.
And there is some time lag even if something goes wrong for me to come from there and attend this. So maybe what I would do in Sakra is I would tell the next OT consultant to cover this OT for some time, tell this guy what should be done in a very short span, go down, do the intubation, settle that. That is what I would have done.
That's good in daytime hours. Suppose you're on call and this is happening at 8 o'clock at night.
Night. Only both of us are there.
Yes.
Then what I would do is first I would maybe send him to assess the case once and then see whether he really requires intubation, because the emergency physicians, what they're actually saying, I don't really know. So I will send him to see. But even then his skills are lesser.
It's so much easier to ask questions than answer.
And now I'll answer. So what I'll do is I'll see the situation of the case in OT. If the case is stable,
Yes.
I'll keep this guy.
Yeah.
And I'll tell him. So these are the things you need to do, tuck, if something goes wrong. And for me, response time is there. So anytime something goes wrong, I'll come back to the OT and deal the situation. And I'll go down and deal the case.
So it's actually not what I was looking for. Okay. And this is a seasoned anesthetist. I mean, jokes apart, and I know in the real world, this deliberately designed. That is how I help question. So the way we look at it, we should look at it, is your duty of care is towards that patient first and foremost. Okay? You have a duty of care firstly to your patient, next to your junior, and next only to anybody else.
So the case is...
So potentially, leaving a first-year junior who's only a month into anesthesia in a craniotomy, you wouldn't feel comfortable with.
Will not become
correct. Yes. You send them down. They are not going to be able to add much value to what an ER they cannot intubate.
Yeah.
So the way to handle that, for example, the correct way would be intubation is a skill that many others in the hospital also will have, including the ER team.
Yeah.
So you would request them to intubate, take them to scan, and get them back. In the meanwhile, you mobilize your resources. Speak to the head of the department if you have to. Get another person to come in. So at no point should you compromise the care of a patient who's already on the table. Try and help.
A patient in OT only.
Exactly. So questions like these.
It's a very tough question to answer. Even if I am not able to answer, then it will be tough for you guys.
No, but it's important, isn't it? So it's just, it gives you a framework of how to... Now, the very fact that you were agonizing so much while answering this, because it tells me that your heart is in the right place. Your answer may not be the one I agree with, but you thought long and hard. You thought about plan A, plan B.
Yeah.
And you, at no point did you just say, I'll send my junior, let them go and do whatever. Because you took all the pressure upon yourself.
That's correct.
Yeah. That to me actually tells me that you are a guy who's really keen to look after your junior and also look after both patients.
I'm trying to do justice to both the patients.
Yes, but that's harder to do because once you go down, you have no idea how long you'll get stuck.
Our primary loyalty is towards
the patient who you're looking after. An anesthetist can only do one job at one time. Look after one patient at one time.
Oh, then these kind of questions are tough to answer.
Exactly. So that's what I keep saying, that just number of years of work is not going to make you better. Suppose you had said, not you, I mean, you have done courses, so I know that. Suppose whoever was listening to this had taken time out, learnt about management. This is a typical, simple concept of what's called crew resource management. Yeah. It's from aviation, we have learned it, or crisis resource management. So you have to put the right person, right resource for the right thing at the right time. So it's something as simple as that. So these kind of questions are more common at a more senior level, because I know you will tell me everything and more. You know more neurophysiology than I do. So there's no point. I said
everything.
So if you're expecting those questions to come up at a consultant interview for a neuroanesthetist, they will never come up.
Yeah,
because that's a given.
One of my friends who's like a very knowledgeable guy. Yeah. Well, that's a very simple question about tracheostomy and desaturation. He got actually confused and he was not able to answer.
Yes.
But he dealt the situation, such kind of situations, many actually with me. But he couldn't answer in the interview.
See, everybody knows the interview is a kind of made up kind of scenario. Pressure is different, and many people do not react very well under pressure. But like it or not, a large part of an anesthetist's job is to be able to work hard and work very well under pressure and have clarity of thought under pressure. So that is why we are assessing these kind of questions. So these sorts of questions, there are many variants of similar thing where you have to prioritize.
Got it.
So these sorts of things, if you put more attention, do a bit of wider reading.
Someone get trained in this kind of tricky questions and all that.
So, I mean, there are courses for interviews also, but this is not just about interviews. This is about a thought process. So what doctors are very good at is reading more and more medical related stuff, but we don't necessarily broaden our horizon. So start reading the books which give you an alternate point of view. Things like behavior, books about human behavior, books about things like behavioral economics.
Okay.
They teach us a lot more about the world around us than the little cocoon that we surround ourselves with. See, doctors typically know other doctors. We spend most of the working day and with other doctors. So we almost become like a group thing. But if you meet people and if you make friends outside of the workplace who are not doctors, they often give you many fresh perspectives. For example, an engineer would probably answer something like this very easily because they're used to thinking like that.
Yeah.
Okay.
So
Does that make sense?
yeah, it's making sense. So better to have friends other than medical also. So
Yes. Makes life more interesting too.
So then we got enough knowledge about how to prepare for interview, what kind of questions will be asked for clinical as well as non-clinical questions we discussed. So I think with this kind of knowledge, then prepare for all the countries as well as in India also different hospitals when you are applying. I think you'll succeed. Thank you very much, sir.
All the very best. If it has helped even a single person listening or watching this, I'll be very happy.
It will help thousands of people.
Yeah.
Oh, thank you very much for coming.
Thank you.
Thank you guys. As usual, Dr. Dheeraj Masapu logging off.